This is From Both Sides, a spontaneous, free-flowing conversation featuring a dynamic team of women, providing insights into both political and civic events affecting the lives of women throughout Pennsylvania. And now, here's your host.
Hello, and welcome to another edition of From Both Sides. I'm Michelle Sitello, your host, and today we'll share with you a very unique show about the latest procedures now available for both men and women to improve your appearance in innovative ways without surgery. Today we'll not only be talking about a technique called CoolSculpting with one of the leading cosmetic surgeons here in central Pennsylvania, but I will actually undergo a CoolSculpting treatment myself today on camera, and we're going to show it to you from start to finish. So you can decide for yourself if maybe CoolSculpting is something that would be of value to you. It's my pleasure today to introduce our guest, Dr. Wendell Funk. He is a board-certified, fellowship-trained cosmetic plastic surgeon with more than 25 years of excellent outcomes for his patients here in central Pennsylvania. Dr. Funk, welcome to the show.
Good morning. Thank you.
Thanks for being here.
Happy to be here.
Why don't you start out by telling us a little bit about your background and your experience?
Okay, well, I'm a native of Lancaster County, born and raised just south of Columbia. And then I went to college here at Lancaster at Franklin Marshall College, then to medical school at Temple. And then I did residency training in Pittsburgh, and I did my plastic surgery training at Ohio State, and then I did my cosmetic fellowship at Manhattan Eye and Ear Hospital in New York City.
Okay, so very big on Pennsylvania training, which is great. So you know the whole state well. And how long have you been practicing?
I've been practicing now for 25 years.
25 years. And I know we're here at your location in Lancaster. You have other locations here in central Pennsylvania.
Correct. I have an office in New York, and I also have an office in Camp Hill.
Okay, great, great. Tell me this, Dr. Funk, how has plastic surgery changed over the years? Because I know, a lot of times, I know women, we all talk about it. Some of us are afraid to actually go under the knife. So how have you seen your practice kind of develop and grow and change over the years?
I think the biggest change we're seeing is the fact that there's a bigger tendency to move to non-invasive procedures. I mean, we still do surgery, and surgery is still the mainstay, but people want to try to do procedures to make them look better without having surgery, or at least delay surgery. I don't think these things ever allow you to avoid surgery, but they certainly allow you to, to delay it. So whether it's injectables or whether it's Botox, and then today, of course, we're going to talk about CoolSculpting, which is a non-invasive way to treat fat. But it's becoming more non-invasive, although surgery is still the mainstay of what we do. Okay.
So what types of people do you see coming in here as your clients or your patients? Do you see men as well as women?
For CoolSculpting or for everything in general?
For everything.
Okay, well, yeah, men and women, of course. I mean, women still comprise, I'd say, probably 85% of what we do, aesthetically or cosmetically. Mm-hmm. But we see men doing it who are trying to just look better to compete with the younger, buff 35-year-old guy, in the same way with a woman who's working out in the gym. But most of us are working longer, not because we have to, but because we want to. And secondly, we all feel younger. 65 is no longer old. And so, all of us want to work longer, be more productive, just because we really enjoy doing what we do.
Well, I can relate to that since I've hit my 60s. I feel like I'm in really good shape, yet
That's young.
Well, I like to think so because I still feel young, but I do think I personally, as I came to see you, I have some problem areas. Mm-hmm. So how is it that when you examined me, you decided that I would be a good candidate for CoolSculpting?
Well, first of all, you had concerns about some unwanted areas of fat, and liposuction became the number one procedure very quickly in the early 80s, and then they finally found ways to treat fat, and one of them is, of course, by freezing it, which is what CoolSculpting is all about. And when I examined you, a large portion of the fat that you did not like was pinchable fat, which made you a good candidate for CoolSculpting, because most CoolSculpting requires pinchable fat. There are a few areas you can do that are not pinchable, but pinchable is the key word for most CoolSculpting.
Which means you can grab it.
You can grab it and you pinch it, and it's not too thick. Mm-hmm. It has to be able to fit within the the heads of the cooling apparatus that we're doing, and you'll see that later on when we move downstairs to do the actual treatment.
Okay. Now tell us a little bit about CoolSculpting itself. Does it hurt? How long does it take? What kind of things can you share with us about
each
that?
treatment takes approximately an hour. In fact, it is an hour. And except there's one head called the Cool Smooth, which takes an hour and 15 minutes. But during that hour, the machine is going to literally grab the fat and suck it up into the cooling apparatus and hold it there. And it's going to hold it there for an entire 1 hour. And it gets very cold, and that's probably the most uncomfortable part of the beginning part of the procedure. And then after a while, with the coldness, it just starts becoming numb. So then the discomfort pretty much goes away. Some people find this very easy. Some people will have more discomfort than others. I can tell you personally, when I had mine done, I fell asleep having it done. And we do this in a room dedicated for this with Netflix so you can watch TV, with the Wi-Fi so you can work on your computer. You just can't move while it's being done. Mm-hmm, mm-hmm. After the treatment is done, however, you're going to have this lump of what I call semi-frozen fat, and they nickname it a stick of butter, and that has to be massaged out and massaged flat. And the results are clearly better if that is done. And that is probably the most uncomfortable part of the procedure, but I certainly wouldn't call it painful, but it's definitely more sensitive.
Okay. Well, I'll be interested to see how I do, because I kind of have a low threshold for pain. But I'm going to do my best, and I'm looking forward to having it done on my midsection, which has been kind of a trouble area for me. I know that in my personal situation, I think I'm fairly fit, but I've always kind of had a bigger midsection, even at my thinnest. Mm-hmm. So I'm hoping that it will work on me, and I'm sure there are other women who have that same midsection issue, especially as they get to their 50s and older.
The abdomen and the flanks are clearly the most common areas, although we do treat some other areas that are off-label, like inner thighs and arms, but the abdomen and flanks are the most common areas. In people of all ages, I've seen people that work out in the gym, they're very buff, and they just want to get a little bit of fat thinned out that they can't get rid of, even though their body fat may be down to 8%. And then we see older people. I've done patients as old as 85 who want to look better in their suits. And so I've been totally amazed with this procedure how many people over 65 want to do it also.
Mm-hmm. And would this also be a good procedure? A friend of mine recently lost, 30, 40 pounds. Would that be a good procedure for him to deal with the fat?
If he's just trying to thin the fat, yes. If he has a lot of loose skin, it will not tighten skin. Now, some people just want to have the fat thinned out, and they're not worried about loose skin, in which case I would say they would be a candidate. But if they want the skin to be tightened, then obviously they're going to have to look to other modalities such as surgery.
Okay. So what are the side effects or after? When I'm done here, I'm going to walk out of here today and go on with the rest of my day.
Yeah, you'll be able to walk out of here and drive home.
Okay. And then are there any kind of side effects or after effects of the CoolSculpting procedure?
Well, you're going to have the areas that are treated are going to be numb. And that numbness is going to last for a few weeks. It's a strange sensation because you'll touch it and yet you feel it, but you don't feel it. It's really weird. Most people just have some discomfort where they'll take some Advil, ibuprofen. There's a small segment of people who will need something stronger, in which case then we'll give them something like a narcotic pain medication. But most people find this very comfortable. There are some people, though, who find this much more uncomfortable than others, but that's less common.
When I'm recovering from the treatment, will I lose any weight?
Probably not unless you did many, many treatments. I mean, we've had some patients who've done 20 treatments. That's 20 hours of CoolSculpting time, and at that point you will. This procedure is very sensitive to weight, however, and if you come back 3 months later and suddenly your weight's up 2 or 3 pounds, that's going to make the result look less effective than it should be. Stability of weight is really important.
Okay, that's really good to remember. And so how long will it take before I actually see something different or notice something different?
Some people will notice results in as early as 2 or 3 weeks. That's less common. I'd say 6 to 8 weeks, 3 months is your final result. If the fat is fairly thick and we know we have to retreat it, we will retreat as early as 4 to 6 weeks and not even wait for the 3 months just to speed up the process. Otherwise, you're doing 3 months, waiting 3 months, doing 3 more months of recovering when you're doing more treatments.
So can you give the viewers some idea of the cost, Dr. Funk, of a CoolSculpting treatment?
I think the cost is going to really depend upon how many areas of treatment that you're going to do. If you're going to do just the abdomen, you may be as low as $2,500, $2,600. If you're going to start doing your flanks, then you can get into $35, $45. I mean, we've had patients who have done even way more than that, in which case you say, well, why not do surgery? Because surgery, in some instances, may be cheaper. But some people will say, I don't want surgery at any cost. I don't want anesthesia. I don't have the downtime. I want to do this and get back to work. So that is why this is so popular, just because there isn't the need for recovery and anesthesia.
So one of the benefits of CoolSculpting is you come in, you do it for an hour, a couple of hours, you're back doing your normal activities right away. There's no downtime.
Very little downtime. I mean, if someone comes in, does 4 treatments one day and 4 more treatments the next day, they're going to be a little bit more uncomfortable. They may not head back to the gym to work out for the first 2 or 3 days. We do like you to wear something compressive for the first 4 weeks. It helps just like liposuction, helps keep the skin shrinking as uniformly as possible, even though this is not a skin tightening procedure.
Right, I brought my Spanx.
That's perfect.
So I don't know how I'm going to do on that because I don't even wear those control top pantyhose. I don't like anything too compressive, but your assistant Julie told me I needed to have the compressive garments to help the process.
Right,
so.
you do want to wear something compressive most of the time for
yeah.
the first 3 to 4 weeks if you can.
Okay, great. Now, do you do the CoolSculpting in all 3 of your offices in Lancaster, York, and Camp Hill? Or?
No, we only do it in the Lancaster office. It's not a very mobile device, and you'll see that when we go downstairs. It's a fairly large machine, and it's not. I mean, you could if you had a van with all the crazy lifts and things like that to do it and move it around, but it's a pretty heavy apparatus.
So what if someone just watches this show and says, gee, I think I want to have Dr. Funk take a look at me and see if I'm a candidate for this. What's the process?
The next process would just simply be to call the office and schedule an appointment, because I'd say only half of our patients are truly candidates for it. We don't charge for the consultation. It's a complimentary consultation. Half of the people simply say it's too slow. I want a faster result, in which case they're going to have surgery. Some people have non-pinchable fat, in which case they're not a candidate for CoolSculpting, but they may be a candidate for other modalities now that are out there for non-pinchable fat.
Okay. Now, tell me, what do you see on the horizon for plastic surgery or cosmetic surgery? Where is it going from here? It kind of started out more surgical. Now and then it kind of went to, I guess, non-invasive injectables. Where do you see any other things coming down the pike for these kind of treatments? Yeah,
there are lots of things that are changing. Apropos specifically to fat, however, is a new technique which has just been released by the FDA 2 weeks ago by the Sitello company, which is a laser company, and it's called SculpSure, and it's a 1060 diode laser. And SculpSure is another way of getting rid of fat. I hate to call it melting fat, but it's almost that, that's what it is. It's basically non-invasive smart lipo, and smart lipo is another modality by Sitello laser company. But this is another way of getting rid of fat, and it's I've already had my first treatment done just this week. So
you've experienced both CoolSculpting and SculpSure.
I have.
Okay, all right.
And they're both very different, but they both work. But this works in non-pinchable fat. So obviously we'll be using both machines interchangeably in people.
So you'll be offering both procedures as you go forward down the road.
Correct.
And then hopefully on our next show we're going to talk about that latest procedure, the sculpting.
SculpSure.
SculpSure.
Yes.
Okay. All right. So CoolSculpting today and SculpSure the next time we have a show.
Correct.
Okay. Great. So what other recommendations would you make for people who are just wondering, they have a change in their appearance, they want to do something, they don't know what to do? Is the best thing just to call you?
Yeah, the best thing would be to call the office, schedule an appointment, because some people want something done for their face, but they don't want surgery. There are non-invasive procedures, although nothing is ever going to replace a facelift. But there's now things called Althera or Altherapy, which is available for gentle skin tightening. There's Pelave, which has 0 downtime, but there is no magic treatment yet which has no downtime with spectacular results. So the facelift is still the gold standard. But a lot of people are doing these other modalities to sort of push the facelift back into the into the 60-70 range instead of the 50-60 range.
Okay, great. Well, thank you, Dr. Funk. We're going
Thank
to take
you.
a break right now, and when we resume, we'll hear a word from our sponsors, and then we're going to actually go downstairs, and you're going to see the CoolSculpting procedure performed on me. Thank you for joining us.
From Both Sides is a production of the Susquehanna Valley Center for Public Policy and is made possible by the support of the Pennsylvania Center for Women and Politics at Chatham University, a nonpartisan center devoted to fostering women's public leadership through education, empowerment, and action. The first to focus on women's political involvement in Pennsylvania, the center integrates disciplinary knowledge, civic education, and capacity building, while examining the intersection of women and public policy. From Both Sides is also supported as a public service by Saul Ewing LLP, a law firm with a 100-year tradition of serving the needs of business, government, education, healthcare, technology, and manufacturing in our region. And by the University Center for International Studies, the engine for extending the global reach of the University of Pittsburgh and its students. From Both Sides is also sponsored by Dr. Wendell Funk, one of Central Pennsylvania's most experienced cosmetic plastic surgeons. Dr. Funk is a leader in new and innovative non-invasive procedures like CoolSculpting. His long-term experience with all types of cosmetic surgery, as well as facial injectables, keeps new and repeat patients returning to his practice in Lancaster, York, and Camp Hill. From Both Sides is also sponsored by the Ed and Jeannie Arnold Foundation.
Welcome back to our second segment on CoolSculpting. We're here in Dr. Wendell Funk's office in Lancaster, Pennsylvania. Joining me is Julie Couric. She's going to be doing the CoolSculpting procedure on my midsection. So I'm sitting here in the office. We're all ready to go. Julie has my tummy marked up. And Julie, do you want to just tell the viewers what we're going to be doing actually right now? What's the next step in the procedure?
We've already marked the areas, and we're going to use 2 of the CoolMax applicators, which are the larger applicators. So she's marked with the template, and we're going to lay a gel protector over her, which protects the skin, and then we'll apply the CoolMax. So this is the suction that we apply, and once it's attached to the fat area, the applicator has to stay on for an hour. So first we're going to put the gel pad on.
Okay.
So we'll go ahead
And Julie, while you're doing that, can you
Sure.
share with us a little bit about your background and experience doing this kind of work?
Sure. I am a licensed medical esthetician, and I've been for 15 years, and I've been with Dr. Funk for 15 years. So I've not only have my license as aesthetics, but I've gotten a lot of training in my 15 years with Dr. Funk.
Okay.
So, and we attended the CoolSculpt University in California, where we both were trained in CoolSculpting, Dr. Funk and myself.
And I will tell the viewers, as this gel pack is going on me, it's very cold.
It is cold
It's
and
like
wet.
ice on my tummy.
I tell patients a lot of times this is the coldest part. So, and you have to just make sure all the air bubbles are out, and that's what I'm doing. Just
And this is the cool of the CoolSculpting.
this is the cool of the CoolSculpting.
Now, when I was first being examined, you did tell me that you thought I was the perfect candidate for this procedure. Can you tell us why?
You're the perfect candidate because you are very pinchable, and when I say pinchable is when I can actually grab the fat in my hands and pull it out, and your fat is not too thick. Some people that come in the office, they're fat, you can pinch, but it's too thick and it would never fit inside the applicator. It has to fit in the applicator.
So this really isn't a process for somebody who's grossly overweight.
It's not. It's for people that eat healthy, exercise. It all works together. So it's an investment. I mean, it's.
Well,
it's a
I like to
procedure.
think I'm in fairly good shape, and I do eat healthy and exercise, but I've always had this problem midsection, which is, I think, something that a lot of women have, and they especially notice it, and I've noticed it more after I got to 50 years of age. So the older I got, the more it seems I've noticed it. So I think this is hopefully the right treatment for me.
It is. I mean, you're a thin person, and it's, you have stubborn areas, and that's, this machine is for those people, this treatment. So
Okay.
I'm going to go ahead. I have all my settings here ready, and I'm just going to turn the suction on. So when I first...
Is it like a vacuum cleaner? Because
It's a
it
vacuum
sounds like a
cleaner.
vacuum
yes,
cleaner.
it's a vacuum cleaner. So once the fat is suctioned in and the applicator's attached, then I will push the cooling button on. So the first 5 to 8 minutes, it's pinching, but after 5 to 8 minutes, you start to get numb. So the pinching and pulling starts to be a lot more comfortable.
Okay.
So, but at first, once it grabs, so it's, you're not sure what to expect, but so I'm going to go ahead and attach. I'm just going to line things up here for a minute. I'm going to have you scoot just maybe a little bit that way for me. Just pull yourself up and go over. Perfect. Okay, there you go. Okay, I'm just applying it, and I'll let you know here in a minute. Can you feel it pulling up in there?
Yes, I can. And it feels very much like a vacuum cleaner that's on high suction.
Okay, it looks good. So now I'm going to put the cooling button on.
It's
This is the hardest part. This is the hardest part because, and just breathe normal. People
Yeah.
feel like, they want to hold their breath because
Yes.
they're like, oh, it's attached.
Yes.
So just breathe normal. So you will sit here for an hour with this attachment on, and patients usually read or take a nap, watch TV or Netflix. But some people, they make phone calls. So you can bring your computer, you can eat your lunch. Some people we have here for several hours. I'm going to have you just hold that for me until I get a support pillow. And I'm going to get one more support tube. So just let me grab that. And I think that's in my corner here.
Oh.
Am I okay?
So this is the worst?
Okay, you can let go. This is the worst.
Well-
It's a little uncomfortable once your hour's over and I pull it off. I have to do a 2-minute massage, and that's just breaking up the fat cells. You can feel some of the fat cells connected, so it's kind of just you're kneading them apart.
So-
and that's a little uncomfortable.
So Julie, in essence, this is pulling the fat cells. Does it pull it kind of to the surface so that my understanding is about 25% of the fat cells will be killed or
Yes.
eliminated.
It's because it's pulling the roll all the way in, and all those fat cells. It's like when I pull it off, you'll see it looks like a frozen stick of butter. So what I'm doing is I'm pushing that butter down, so it just helps to break up the cells that we've treated. And that's just it's a recommendation from the company, and it's just they initially didn't do that, but then they realized that patients were getting better results. So now it's part of the
procedure.
treatment is a 2-minute massage.
Well, I've got to say, it was a surprising feeling when that pulled at my midsection, but really now that it's on, it's really not that uncomfortable.
Yeah, and it's going to continue to get more comfortable because you're going to become numb. So I have basically at this point is when I treat other patients while you're being treated, but you have a call button that I usually attach, and that's when I give you a blanket. You can watch TV or get on your laptop. The machine it automatically will count the hour and shuts off, and that last hour shuts off itself. But at the last 10 minutes of the treatment, the patient will start to feel almost a release, and that's a massage segment of the treatment.
Okay.
So, and that's part of the last 10 minutes. So this will be on an hour. You take it off, you do the 2-minute massage, and then I'll place it on the other area.
Okay, great. Thank you so much.
You're welcome. Okay, the first treatment is over. So I'm going to go ahead and turn the suction off.
Okay. I've got to say that once the procedure started, I really wasn't in any pain whatsoever.
Okay,
It wasn't even really uncomfortable.
good. So I'm going to go ahead and just jiggle the side here, release this. I'm going to pull away, and then you're going to see what we talk about when we say stick of butter.
Oh, yes.
This is exactly what we want to see when it's standing nice and tall like this. I'm just going to...
So this indicates maybe I'll have some positive results.
Absolutely.
And this will eliminate about how much of the fat cells?
25% of the fat cells will be frozen, and the fat cells leave your body through the lymphatic system. So through your urine, your sweat glands, and in 2 months, in 2 months you'll start to see your results. 3 months is your final result, but it is 20 to 25% of the fat cells. So I'm going to go ahead, and this can be a little uncomfortable. I need to push this down.
Well, I am going to tell you that
And
my
start
skin
massaging.
feels very cold, and it does kind of feel like a lump.
Yeah. So I am pushing this down and kneading it in a way that you can almost feel the little cells break up in here, the little clumps of fat. So I need to do this for about 2 minutes, but you're going to feel a little bloating. You could be a little bruised. Afterwards, you're going to feel like you've worked out in the gym and done some crunches. So,
But no real restrictions, Julie. I could go out and go for a walk. I could get showered. I'm going to go out this evening. Shouldn't have any problems.
no restrictions. You could go to the gym, but you probably won't feel like it.
Okay. I did take a couple of Advil, as Dr. Funk recommended, just to alleviate any soreness I might have.
Okay. We do like patients to wear a Spanx type of garment or girdle or compression to help just compress the skin, and for 2 weeks. And we like you to do that even if you can sleep in it.
Oh,
just
okay.
to help the compression.
And I did bring that. I did bring the Spanx
Okay,
garment.
so for 2 weeks with that, drink lots of water. And then Dr. Funk will see you back in 2 months, and at that point we'll evaluate the area that was treated, because at that point is when you start to see the results.
Okay.
And some people need, more than one treatment depending on the thickness of the fat, and at that point when you see Dr. Funk in 2 months, we can decide whether or not you want to retreat the area.
Okay. All right. Well, it's been interesting. It certainly hasn't been painful. I think that if I get 25% reduction, I'm going to be really pleased with the treatment. And it's easy to do. And I think part of why it's so easy, Julie, is because I really didn't have any preparation, and I don't really have any restrictions now once I'm done today. So
Yeah, we have patients that go right back to work, so there really is no downtime. You're a little sore, and some people can have a little more discomfort than others, but really it's an easy procedure. You're in and out, and there's no cutting or anesthesia involved. So.
And how about age
Very
restrictions to do this procedure? What's the youngest? What's the oldest?
We've done, I'm going to say, the youngest patient 19. And probably all the way into the mid-80s.
Okay.
So it's quite a range. Nobody wants fat. So that massage is over. So now, and you don't massage at home or do anything. This is just done in the first 2 minutes,
Okay.
just to push that area down. So you don't have to do any massaging when you get home. So now we can.
So the first treatment is complete.
First treatment is completed.
Okay, great. Thank you very much.
You're welcome.
Thank you for joining us today for another edition of From Both Sides. I hope you've enjoyed our show. I think it was especially designed for our women, but remember too, men are candidates as well for processes like CoolSculpting and the newest non-invasive procedures to improve your appearance. So thank you for joining us, and we hope you feel as we do, that as women in Pennsylvania, there's much more that unites us than divides us. Thank you.